I'm Charissa, one of the hygienists here at Atlanta Dental Spa, and I want to take just a moment of your time to talk to you about the F word in dentistry. You know the one. Flossing. Did you know that daily use of dental floss is just as essential as brushing your teeth? Maybe even more so. Brushing alone is not enough to disrupt the sticky bacterial film that collects between the teeth and below the gum line. Leaving that bacteria behind can actually allow them to set up colonies which secrete acids and toxins below the gum line and around the teeth, and that can lead to tooth decay, gingival inflammation, and bone loss. By flossing once a day, you can help prevent these issues, but proper technique is key, so let me take a moment to demonstrate. First, you want to start with a piece of floss that's about 10 to 12 inches long. And as far as floss type goes, that's really more personal preference. So if you liked tape, waxed, unwaxed, flavored, whatever works best for you, great, use that. Although I will caution you away from the little floss picks. Sometimes it's really hard to get those to fit well around the back teeth, and they can break and shred between the teeth. So what you want to do in your dominant hand is pinch the floss between your index finger and your thumb and wrap it twice around your index finger, pinching it and holding it together. With your opposite hand, you'll want to pinch it between the same two teeth and then grasp the remaining floss with your fingers. The closer you hold your fingers together, the more control you have over where that floss goes. So, as you floss, you want to use your index finger and the tip of your thumb to guide the floss exactly where you want it to go. Place it right in between the last two teeth and gently seesaw it back and forth down through the contact where the teeth touch. Once you're past that contact, hug it in a C shape around the back tooth and gently scrape it up and down 3 or 4 times to disrupt any bacteria that have collected below the gum line. Hug it around the opposite tooth and do the same thing. Once you've flossed between 2 or 3 teeth, you'll want to wrap that floss again around your dominant finger to get a new piece of clean floss, and continue until you've flossed between all of your teeth. So if you are new to flossing, you might find that the first few times you try it, you get some bleeding. And that's just an indication that there are some bacteria that have secreted toxins around the gum line. Once you get consistent with doing it, you should notice that the tissue tightens and firms up and the bleeding should resolve. If after a full week of flossing you're still seeing bleeding, give us a call to come in for an evaluation for potential infection. Otherwise, embrace your newfound skills along with your daily brushing and come see us for routine visits to keep your mouth at optimal health.